This is a tragic story. It is the story of a 43-year-old woman who presented to the emergency department complaining of abdominal pain. This patient was well known to the staff in the emergency department because she was a patient with substance use disorder, and she would frequently present to the emergency department complaining of various painful syndromes, requesting narcotic pain medication. She was recently seen in the emergency department a day or two prior. She was evaluated. Full comprehensive emergency department evaluation was done, including laboratory, including CAT scan of the abdomen and pelvis, and everything was unremarkable, and she was given instructions to follow up with her primary care doctor and community resources. She was consistently non-compliant with aftercare instructions, and she was back a day or two later complaining of the same pain. She presents to the triage desk at the hospital, and the triage nurse recognizes her and decides that she doesn't have an emergency. So she sent her to the waiting room to wait. And I can tell you at this hospital, it wasn't unusual for patients to present to the emergency department and be triaged to the waiting room, and honestly, are never seen. And as she started to feel worse, her boyfriend, who was accompanying her, went back up to the triage desk to try to have the triage nurse take action. And the triage nurse basically felt like the patient was crying wolf. She was just here yesterday, the day before. She is a drug seeker, and basically we don't have time for that. So time passes, about 45 minutes. The patient continues to get worse. She falls out of the chair onto the floor, and she's writhing around in pain on the floor. The boyfriend calls 911 from the ER waiting room to request to be moved to another hospital. Another patient that's in the waiting room also sees what's going on and calls 911. At this time, the patient starts vomiting blood, and the janitor is called to clean up the mess. And literally, the playback of the cameras show that the janitor mopped around her like she was a piece of furniture. As commotion increased in the waiting room, the triage nurse felt threatened, particularly by the boyfriend, and called the police. The police arrive, and they assess the situation. They run the patient's name and determine that she has outstanding warrants for drug possession, and they arrest her. As they are moving her from the waiting room floor to outside to their squad car, she collapses and codes. Her heart stops beating. She becomes unresponsive. So a code is called, and she is then, of course, taken to the back, and resuscitation attempts are initiated, but they are unsuccessful, and she dies. I think the takeaway from cases like this is not necessarily to fault individuals for systemic problems, because that doesn't solve the problem. Yes, this triage nurse absolutely made a mistake. She was wrong. There is no defending the triage nurse. But I will also say that the system is broken. The entire system is trash and just needs to be reimagined. From the patient perspective, from the physician perspective, from the nursing perspective, hospital administration perspective, the entire system needs to be reimagined. Otherwise, situations like this will continue to occur.